Acute bronchitis is a common respiratory illness that affects millions of people each year. It is particularly prevalent during the colder months when respiratory infections are more common. It affects your bronchial tubes, the airways that carry air to your lungs. These tubes are essential for breathing, as they allow the passage of air in and out of your lungs. When these tubes get inflamed, they produce more mucus. This inflammation is the body's response to infection or irritation, and it can cause the bronchial tubes to swell and narrow. This extra mucus can make it hard to breathe and cause you to cough. The cough is often persistent and can be quite severe, sometimes leading to discomfort and difficulty sleeping. Acute bronchitis is usually caused by a virus, such as the common cold or flu virus. These viruses are highly contagious and can spread easily from person to person through coughing, sneezing, or close contact. It is different from chronic bronchitis, which is a long-term condition often caused by smoking or prolonged exposure to irritants. Chronic bronchitis is a type of chronic obstructive pulmonary disease, COPD, and requires ongoing medical management. Most cases of acute bronchitis clear up within a week or two. During this time, it is important to rest, stay hydrated, and avoid irritants like smoke and strong odors. However, the cough may linger for several weeks. This lingering cough is due to the continued irritation and inflammation of the bronchial tubes, even after the initial infection has resolved. While acute bronchitis can be uncomfortable, it is usually not serious. Most people recover fully without any complications, although it can be more severe in young children, the elderly, and those with underlying health conditions. Simple self-care measures and over-the-counter medications can help you feel better. These may include pain relievers, cough suppressants, and decongestants to alleviate symptoms. However, it is important to see a doctor if your symptoms are severe or if you have any concerns. Persistent high fever, shortness of breath, or chest pain should be evaluated by a healthcare professional to rule out more serious conditions. Acute bronchitis often starts like a common cold. You might experience a runny nose, sore throat, or mild headache. As the illness progresses, the hallmark symptom of bronchitis develops: a persistent cough. The cough associated with bronchitis is usually dry at first, but it may become productive. This means you start coughing up phlegm, which can be clear, white, yellowish, or even greenish in color. Other symptoms of acute bronchitis can include chest discomfort, wheezing, shortness of breath, and low-grade fever. It's important to note that these symptoms can also be caused by other conditions. If you are experiencing any of these symptoms, it is important to see a doctor for an accurate diagnosis and appropriate treatment. In most cases, acute bronchitis is caused by a viral infection. The same viruses that cause the common cold and the flu can also lead to acute bronchitis. These viruses spread through tiny droplets in the air when an infected person coughs or sneezes. Less commonly, acute bronchitis can be caused by bacteria. Bacterial bronchitis is less common than viral bronchitis but may require different treatment. Exposure to irritants such as smoke, dust, or fumes can also irritate the bronchial tubes and lead to bronchitis. Understanding the cause of your bronchitis is important for proper treatment. Your doctor can help determine the cause of your bronchitis and recommend the best course of action. Diagnosing acute bronchitis usually involves a physical exam and a review of your symptoms. Your doctor will listen to your lungs with a stethoscope to check for any abnormal sounds, such as wheezing or crackling. They may also ask about your medical history and any recent exposure to sick individuals. In most cases, a chest X-ray is not necessary for diagnosing acute bronchitis. However, your doctor may order one if they suspect pneumonia or another complication. It is important to see a doctor if your cough is severe, lasts longer than 3 weeks, or is accompanied by difficulty breathing, high fever, or bloody phlegm. These symptoms could indicate a more serious condition that requires prompt medical attention. Section 5. Treatment options. Easing your bronchitis. Woes. Bronchitis can be a challenging condition to manage, but with the right approach, you can ease your symptoms and support your recovery. Since acute bronchitis is usually caused by a virus, antibiotics are not effective in treating it. This is because antibiotics target bacteria, not viruses. Therefore, using antibiotics for viral infections like acute bronchitis can lead to unnecessary side effects and antibiotic resistance. Treatment for acute bronchitis focuses on relieving symptoms and supporting your body's natural healing process. This means that instead of targeting the virus directly, the goal is to make you more comfortable while your immune system does its job. Rest is crucial for allowing your body to fight off the infection. Giving your body the time it needs to recover can significantly shorten the duration of your symptoms and prevent complications. Drinking plenty of fluids such as water or herbal tea can help thin the mucus and make it easier to cough up. Staying hydrated is essential because it helps keep your throat moist and can soothe irritation. Over-the-counter pain relievers like acetaminophen or ibuprofen can help reduce fever and relieve body aches. These medications can also help manage headaches and other discomforts associated with bronchitis. A humidifier or taking a hot shower can also help loosen mucus and ease congestion. The steam from these methods can open up your airways, making it easier to breathe and reducing the severity of your cough. In some cases, your doctor may prescribe medications to help open up the airways and relieve wheezing. These medications can include bronchodilators or inhalers, which are particularly helpful if you have underlying conditions like asthma or chronic obstructive pulmonary disease, COPD. Additionally, using a saline nasal spray can help keep your nasal passages moist and reduce congestion. This can be particularly beneficial if you are experiencing a lot of nasal discharge or a blocked nose. Incorporating gentle exercises like deep breathing or yoga can also support your recovery. These activities can help improve lung function, reduce stress, and promote overall well-being. It's also important to avoid smoking and exposure to secondhand smoke, as these can irritate your lungs and worsen your symptoms. Quitting smoking can significantly improve your lung health and reduce the risk of future respiratory infections. Maintaining a healthy diet rich in fruits, vegetables, and lean proteins can support your immune system and help your body fight off the infection more effectively. Proper nutrition provides the essential vitamins and minerals needed for recovery. Practicing good hygiene, such as washing your hands regularly and using hand sanitizer, can prevent the spread of the virus to others and reduce the risk of secondary infections. Wearing a mask when you are around others can also help prevent the spread of the virus, protecting those around you and reducing the risk of further transmission. Always follow your doctor's advice and attend follow-up appointments to monitor your progress. Your healthcare provider can offer personalized recommendations and adjust your treatment plan as needed to ensure the best possible outcome. Section 6. Home Remedies, Finding Comfort and Relief. In addition to medical treatments, several home remedies can help soothe your symptoms and promote healing. Gargling with warm salt water can help relieve a sore throat. Honey can also help soothe a cough and has antibacterial properties. Adding honey to warm water or tea can be an effective way to ease your symptoms. Getting enough rest is essential for your body to recover. Avoid strenuous activities and allow yourself plenty of time to sleep. Eating a healthy diet rich in fruits, vegetables, and whole grains can boost your immune system and support your body's defenses. Section 7. Preventing Bronchitis, Steps for a Healthier You. Bronchitis is an inflammation of the bronchial tubes, which carry air to your lungs. It can be acute or chronic, but today we will focus on preventing acute bronchitis. Preventing acute bronchitis involves taking steps to reduce your risk of infection and strengthen your immune system. This can be achieved through a combination of good hygiene practices, lifestyle changes, and medical interventions. One of the most effective ways to prevent the spread of germs is to wash your hands frequently with soap and water. Make sure to scrub all parts of your hands, including the backs between your fingers and under your nails, for at least 20 seconds. Use hand sanitizer if soap and water are not readily available. Hand sanitizers with at least 60% alcohol can quickly reduce the number of germs on your hands in many situations. Avoid close contact with people who are sick, and if you are sick, stay home to avoid spreading the infection to others. This is especially important during the cold and flu season when respiratory infections are more common. Cover your mouth and nose with a tissue or your elbow when you cough or sneeze. This simple action can significantly reduce the spread of germs to those around you. This helps prevent the spread of germs through respiratory droplets. Respiratory droplets can travel several feet and can land on surfaces or be inhaled by others, leading to the spread of infections. Getting vaccinated against the flu can significantly reduce your risk of developing flu-related bronchitis. Vaccines help your immune system recognize and fight off the flu virus, which can prevent complications like bronchitis. Additionally, maintaining a healthy lifestyle can boost your immune system. Eating a balanced diet rich in fruits and vegetables, exercising regularly, and getting enough sleep are all crucial for keeping your immune system strong. Staying hydrated, avoiding smoking, and managing stress are also important. Smoking can damage your bronchial tubes and make you more susceptible to infections, while stress can weaken your immune system. By following these steps, you can significantly reduce your risk of developing acute bronchitis and other respiratory infections. Remember, prevention is always better than cure. Stay informed, stay healthy, and take proactive steps to protect your respiratory health. Section 8. The importance of vaccination. Vaccination is a crucial step in preventing influenza, a common cause of acute bronchitis. The flu vaccine helps your body develop immunity to the influenza virus, reducing your chances of getting sick. Getting vaccinated not only protects you, but also helps protect those around you, especially those who are more vulnerable to serious flu complications. These vulnerable individuals include young children, older adults, and people with weakened immune systems. Talk to your doctor about getting the flu vaccine, especially if you are at higher risk of complications from influenza. Section 9. A final word. Listen to your body. Acute bronchitis is a common respiratory illness that usually resolves on its own with rest and home care. However, it is important to be aware of the symptoms and seek medical attention if your symptoms are severe or do not improve. By taking steps to prevent infection and seeking prompt medical care when needed, you can effectively manage acute bronchitis and minimize its impact on your health. Remember to listen to your body, rest when you need to, and consult with your doctor if you have any concerns. Lifestyle Authentics would like to send a special thanks. Don't forget to like, subscribe, share.